A Social Security announcement expected any day now could quietly affect what millions of beneficiaries actually keep from their monthly checks, and the number creating concern is $220 or more. For people receiving retirement benefits, SSDI or SSI, the issue is not only whether the next cost of living adjustment, known as the COLA, increases the benefit on paper. The deeper issue is whether Medicare takes a major piece of that raise before the money ever reaches the bank account. Roughly 70 million Americans could be affected, including retirees, disabled Americans, widows, widowers, seniors on fixed incomes, veterans receiving both VA and Social Security benefits, and households already trying to stretch every dollar. The warning sign is tied to the annual Social Security Board of Trustees report, which is released only once per year, typically between mid-April and mid-June. Here's where it gets interesting. Inside that report are projections for the 2027 Medicare Part B premium, and the figures already being watched suggest the standard premium could reach $220 a month or higher. That matters because the standard Medicare Part B premium in 2026 is $185 per month, and for many Social Security beneficiaries, that premium is deducted automatically before they ever see their deposit. The last trustees report, released in June of last year, already projected the 2027 Part B premium at just over $218 per month. Since then, the source material points to higher prices, inflation, and rising healthcare expenditures, which may push the next projection even higher. If the updated estimate reaches $220 per month or more, it would be a difficult milestone for people depending on Social Security for groceries, prescriptions, utilities, housing, transportation, and basic daily needs. Now notice this. The source material frames the possible increase from the current $185 premium to the 2027 level as approximately $17 per month. For someone with a cushion, $17 may not sound overwhelming, but for a person living on a fixed income, that amount is real money taken out before it can be used for food, medicine, rent, an electric bill, or a necessary appointment. This is why Medicare Part B premiums matter whenever beneficiaries discuss the COLA. Every year, people wait for the cost of living adjustment because it is meant to help monthly checks keep up with rising prices. But many focus only on the headline percentage and assume the full increase becomes spendable income. The problem is that Medicare premiums can reduce that increase immediately. The source material gives a simple example using a $1,000 monthly Social Security benefit and a 3.4% COLA. A 3.4% adjustment on $1,000 equals a $34 monthly raise. That may sound helpful, but if the Medicare Part B premium rises by $17 per month at the same time, that $17 is deducted directly from the check, and the $34 raise effectively becomes only $17 in usable money. In that example, half of the COLA disappears before the beneficiary can spend a single dollar. Early projections mentioned in the source material place the 2026 COLA somewhere from the low 3% range to potentially the high 4% range, although the final number is not available yet and comes later in the year. The 3.4% figure is only an example, but it clearly shows how a premium increase can shrink the practical value of a Social Security raise. The official 2027 Medicare Part B premium announcement is expected around the first week of November, which the source material describes as about 6 months away. But the trustees' report expected soon matters because its preliminary projections are usually very accurate, often within a tight range of the final number. For those enrolled in Medicare, the premium is often taken automatically from the monthly payment. The deduction is already built into the deposit. That is why some people feel confused after a COLA is announced. They hear that benefits are rising, but when the payment arrives, the increase feels smaller than expected because Medicare may have already taken more. A $220 Medicare Part B premium is not good news for people on fixed incomes. For seniors, disabled Americans, widows, widowers, and veterans collecting both VA and Social Security benefits, every added dollar of premium is a dollar no longer available for groceries, prescriptions, utilities, transportation, or keeping the lights on. Over a full year, $17 per month becomes $204, which shows why early preparation matters. This is where the story shifts from concern to action. While beneficiaries wait for the trustee's report and the later official premium decision, there are programs that may help protect income, reduce costs, or put more money back into the household budget. Extra Help, also known as the Low-Income Subsidy, can save qualifying Medicare beneficiaries $300 to $500 per month on prescription drug costs, and the source material emphasizes that many people who qualify have never applied. Medicare savings programs may pay the Medicare Part B premium, all $185 of it, in 2026, and possibly the projected $220 premium in 2027 if the person qualifies. If a Medicare savings program covers Part B, it could offset the entire increase being discussed and protect the monthly check from that deduction. SNAP benefits are another resource. If a person receives SSI, they may qualify automatically, and the average monthly benefit is around $187. The source material also encourages people to contact Chapter Medicare, especially if their Medicare plan has not been reviewed recently. Chapter Medicare is described as having more than 20,000 plans in its network, and the call is described as completely free. Here's where it gets practical. Waiting passively for a report can leave people blindsided, but checking available programs before the official premium is set can make a real difference. Extra Help could reduce prescription costs by $300 to $500 per month. A Medicare savings program could pay the current $185 premium or the possible $220 premium in 2027. SNAP may help SSI recipients because the average benefit is around $187 per month. A Medicare plan review, including through Chapter Medicare as mentioned in the source material, may reveal a better option within a network described as having more than 20,000 plans, with the call described as free. The broader message is preparation, not panic. Once the annual Social Security Board of Trustees report is released within the usual mid-April to mid-June window, the projected 2027 Medicare Part B premium will become clearer. If that projection reaches $220 a month or higher, beneficiaries should immediately think about how it interacts with the next COLA. The example from the source material explains why. A 3.4% COLA on a $1,000 benefit creates a $34 monthly increase, but a $17 Medicare premium increase cuts the usable raise to $17. This is easy to miss when people focus only on the COLA headline and not on the deductions that follow. What stands out is how quietly this can happen. A beneficiary may hear that Social Security benefits are going up, expect the full increase to help with groceries, prescriptions, rent, or utilities, and then discover that a higher Part B premium has already reduced the amount that actually reaches the household. That is why the possible $220 premium deserves attention before it becomes final. It is not just a line in a government report. It can determine how much of the next Social Security raise actually stays in the check. The concern is especially serious for seniors depending on one monthly payment, disabled Americans with ongoing medical costs, widows and widowers managing expenses alone, SSI recipients with extremely limited income, and veterans balancing VA and Social Security benefits. For these groups, a Part B premium increase is a direct budget event. The previous report already projected the 2027 premium at just over $218. With inflation, rising prices, and higher healthcare expenditures mentioned in the source material, the concern is that the next projection may be higher, possibly $220 or more. The action plan is straightforward. Watch for the annual Social Security Board of Trustees report during its usual mid-April to mid-June window. Compare the new projection with the current 2026 standard Medicare Part B premium of $185 per month and the earlier projection of just over $218 for 2027. Calculate how a possible premium increase would affect the actual COLA left in the check. Using the example, a $1,000 monthly benefit with a 3.4% COLA gets a $34 increase, but a $17 Part B premium increase leaves only $17 in net additional money. Check Extra Help because qualifying beneficiaries may save $300 to $500 per month on prescription drugs. Review eligibility for Medicare savings programs because these programs can pay the Part B premium, including all $185 in 2026 and possibly $220 in 2027. look into SNAP benefits, especially for SSI recipients who may qualify automatically because the average monthly benefit is around $187. Review Medicare plan options. If the plan has not been checked recently, including the Chapter Medicare option mentioned in the source material, which is described as free to call and connected to more than 20,000 plans. These steps are about being ready. People paid into the system, earned their benefits, and deserve to know how premiums, COLA projections, assistance programs, and plan choices affect monthly income. If the trustees' report shows a 2027 Medicare Part B premium at $220 or higher, beneficiaries should not treat that as distant news. They should think immediately about prescriptions, food assistance, premium assistance, Medicare plan reviews, and the real net impact on the COLA. The official premium comes later, around the first week of November, but preparation is easier before the final number begins affecting expectations. Clear information is the best defense against being surprised. A $220 premium would be a warning sign for people who count on every dollar. A $17 increase may cut a $34 example COLA in half. A $185 premium in 2026 may become a heavier deduction in 2027. For roughly 70 million Americans, the difference between a raise on paper and a raise in the bank account is what matters most. Share this information with anyone receiving Social Security retirement benefits, SSDI or SSI, and with anyone helping a parent, spouse, neighbor, or veteran manage benefits. Stay alert for the annual report, watch the November premium announcement, check every program that could reduce costs, and remember the most